Why did I take a vaccine?
Yeah.
So I don't get the flu.
Yeah. The 6th Annual West Virginia Minority Health Fair brought together different health organizations and residents of Huntington, most of whom were minority and medically underserved communities, in the bid to promote health.
The purpose of the 6th Annual West Virginia Minority Health Fair is to really shed light on the health disparities that's taking place in the state of West Virginia. And when we say health disparities, we're referring to minorities who bear the burden of chronic diseases, so hypertension, diabetes, obesity, preterm birth, you name it, across the spectrum. Black and brown folks or individuals are dying at alarming rates from diseases that are preventable and treatable if we catch and detect them earlier.
This event that took place at the Radar Park on September 21st was very timing, with the peak period of influenza virus, a virus of upper respiratory system, which can be very deadly, and the most effective method to prevent the virus is by the flu vaccine, and Walgreens was on the spot, providing immunization, even to those without health insurance. How do you get connection to be here this afternoon?
The company sends us out to do community service work. Like I said, we all work for the store here on Hal Greer, so they give us permission to go out and do some community service work, get our name out into the area, help with the health of the community.
Somebody come here and want to get the vaccine
We
and doesn't have insurance.
For the flu shot,
Yeah.
we have a voucher that we can do if they have no insurance.
Okay.
The COVID shot, we don't have vouchers for. But for the flu shot, if they don't have insurance, they can stop by and we can get them taken care of.
Okay, and this is the flu season.
Correct, exactly.
And so this is timing.
Yes, definitely through probably April of next year.
Okay. With the goal of promoting health and preventing some of the chronic diseases like hypertension, screening of blood pressure by medical and pharmacy students were part of the activities, while screening of blood sugar for early detection of diabetes were also going on.
Rice and things, and their blood sugar went up over 200. So that was in response. So it could be in response to that meal, but we just don't want that to happen all the time. If if it's spiking too high, it could lead to So like getting your A1C tested, that 3-month blood sugar average might be something to look into, because it could be just like a situational thing. Because that person definitely, she's like, I don't have diabetes, but she's like, so it could happen. That's so like just like her, it's as long as it's not above 140, everybody's blood sugar goes up after eating and then gets back down. Okay, can I get you a Band-Aid? You don't think you need one? Okay.
They check your blood sugar.
Yes.
How does it look like?
Looks good, 120, but I just ate. I just had lunch.
Did they tell you how much it's supposed to be?
Yeah, 140.
140 max.
That's what she told me.
Okay, say your blood sugar. What are you going to do then? What have they told you?
Well, this is kind of different for me just finding out. So when I'm getting ready to have surgery next month, so I'm gonna have all this tested all over again.
Yeah.
Yeah,
So that will be.
I have high blood pressure. Well, just like the second month that I'd have found out that I had high blood pressure.
To use?
So,
But they're checking your blood sugar right now.
yes, I'm getting ready to go down here and get my blood pressure checked now.
Okay. In the process of bringing health awareness, other vendors were providing information about the services they offer, with the overall goal to bridging the gap between communities and community-based organizations.
The PA program is a physician-assisted program. It's a master's program that's 28 months long here at Marshall. So you get an undergraduate degree in some kind of science, and then you can apply. You'll go to school for 28 months. Half of it is didactic, and the other half you do clinicals, working with local physicians and providers. And then when you graduate, you take a national board exam, and then you can practice as a PA.
Okay. What is the minimum requirement to get in? Undergraduate?
A bachelor's
degree.
Yes.
In any discipline?
In any discipline, as long as you have the prerequisite classes, which are basic science prereqs.
Where do they work and what do they do actually?
So they can work in hospitals or clinics, and they can work under any specialty. So you can work as first assist in surgery, or you can see your own patients in a family care clinic and be their primary care provider.
Okay, thank you so much. In the brief summary, what is the Period Education Project?
The Period Education Project is a nationwide organization that is led by medical students to help decrease the stigma around menstrual health for adolescent girls. So we like to hang out in the community and just kind of normalize periods, period health, and what all those things are about. To get involved with the Period Education Project, you can Google it. We have a website and a blog about all kinds of different topics.
Okay. You want to say something?
Oh no, I was just going to say this QR code.
Oh, okay. There's a QR code.
Yes.
Yeah. So anybody can scan it to get all the information.
Yep, bring you right to the website.
Okay. Thank you so much.
You're welcome.
Okay.
Oh, I would say the biggest thing that we want to bring here is just a safe community, a safe space for you to talk and to be seen. And the biggest thing too is that working with the medical school, we have resources that I feel that a lot of people can benefit just in the community as well as everybody else around us too. Add on to what Javon was saying, one of the primary missions that the Multicultural Advisory Committee is in charge of is to, one, be a central hub for information between the different health specialties across Marshall's medical campus. So the medical school, the pharmacy school, PA school, nursing school, and all the different health specialties. We're a central hub for all things diversity and inclusion for those programs. And then also having undergraduate outreach to make sure that we're facilitating a pipeline for more diverse students to matriculate into the medical school. So we're really proud of the work that we've been able to do so far and the impact we've been able to have in our community, both on campus and outside of campus. We really do appreciate your support. Attending events like this, like the Minority Health Fair, is one of the few things that we look forward to being able to help provide for you all. And we're just looking forward to the different missions and different events that we have coming up down the pipeline. So
we are the local rape crisis center for Cabell, Unison, Mingo, Lincoln, Logan, and Wayne counties. We provide direct services. We work within the courts with law enforcement. We have a 24-hour hotline, and all of our services are free and confidential.
The ETBD Therapy Horse told us how they use horses as service animals for therapy and are working in collaboration with different health professionals. What kind of therapy?
Well, we offer recreational therapy and learning activities for children and the elderly and every age in between. We will work side by side with therapists and mental health professionals if they want to bring their clients out to the farm, and we're experts with the equines.
And you often get health professionals coming with patient clients to you.
That's right, and we serve as the equine specialist. We are the intercessor between the professional and the horse and the patient.
And you have been seeing some output on what?
It's just amazing what horses can do.
They feed off of your energy, so if you're very calm, then they're calm. If you're very excited or even have anxiety or things like that, then they help just kind of get to a point to where you can trust the equine, they can trust you, and they can hear a heartbeat from 4 feet away. So they just know, they intertwine with
we watch
humans.
a lot of the patients, clients build confidence. The horses are very non-judgmental and very patient. For the small children, we teach safety. We just teach them a lot of life skills.
They're able to overcome fear, and like you said, increase their confidence, and it's amazing.
Thank you so much.
Yeah.
And one more thing I'd like to add, what we love to do is we will take them into assisted living homes and nursing homes and spend time with dementia patients. And what is so amazing is the patient will just come to life and reflect on their childhood. At that age, they grew up on a farm and they want to talk about their horses. So we really brighten the days of a lot of the elderly when we take them inside of them.
Like kind of memories.
Yes, it brings back memories, long-term memories.
Go back to the roots,
So we'll take them right bedside and they'll rest their little heads right up on the patient's bed with them and just spend quality time. It's amazing.
This is... The West Virginia Minority Health Fair, organized by Marshall University Minority Health Institute, started 6 years ago under the leadership of Professor Wolf, has now gained recognitions, and many more people came out and took the advantage of the free health services.
Anthony Watts. I am the chair and professor of the Department of Public Health at Marshall University. I'm also the founder of Minority Health Institute. The overarching goal of Minority Health Institute is to reduce health disparities among underserved population and minorities in West Virginia. And in effort to accomplish this goal, 6 years ago in 2018, I decided to form what we call West Virginia Minority Health Fair. The idea behind Minority Health Fair is to bring together health organizations throughout West Virginia to share resources and also to engage in health promotion activities and disease prevention activities. And we have done this by inviting known community health organizations in West Virginia.
Do you have any statistics or any data to show how much that has impacted the minority community?
Yeah, one of the accomplishments is that before this program was instituted, there was nothing like minority health fair in West Virginia, period. Since we initiated this program, our attendance in terms of health organizations that have registered to display at this health fair has increased twofold. We started with 15 organizations. At this particular organization here, this particular health fair this year, we have had 46 community health-based organizations that have registered for this program. But the most important thing that needs to be emphasized is the benefit that it brings to the community, because these organizations come and do activities such as screening. I myself, I have just done a screening for diabetes. They have done screening for other diseases, and so this is a major benefit to the community.
The event was full of entertainment, music, and food. Ernest Kumba for Gaza Media. The health fair is over. How do you feel about it, and what were the successes?
It was a great turnout, and we had great weather. But very, very good turnout.
And what were you actually doing?
Edwards Comprehensive Cancer Center.
Okay.
Yes. Yes.
So you were able to speak to some people?
Yeah, we talked to some people about some lung screenings and mammograms. We got them signed up, so they save lives.
Okay, thank you for coming out.
Thank you. You have a good day.
Yeah, you too.